I remember many, many years ago, you were very passionate about like brain training.
I was certified in a school for teachers in a program created by psychiatrists in 1960. It's called Brain Gym, GYM, like gymnastics. Yeah, so brain gym is the kinesthetic motions that separate the top brain, the bottom brain, the left brain, the right brain, the forebrain, and the back brain, and stimulates all of those areas to give you a really good balance. And it's good for learning, it's good for memory, it's good for focus. So I used it as a teacher. I did see a miracle the first time I ever did brain gym. I saw a miracle happen. And that's why I still use it as a therapist. I had a boy that I was working with. I can tell you his name because I've been given his permission plus his mom's. Elmo was in America for 3 years, speaking English as a second language for 3 years. He could answer any verbal question you gave him, anything. Incredibly smart. With 3 years of English as a second language, he spoke fluently at the seventh grade level. At the Heard Museum, a lady held up a Kachina doll, pretending this is a Kachina doll. She wants some little third grade go, that's a Kachina doll. She called on Elmo, and Elmo said, that's an ancient Indian artifact symbolizing their faith in their deity. That boy was incredibly intelligent, but he could not write. He
Hmm.
could write his letters, but they were all capital, and he was compulsive. He'd write, just to write the E took him like a minute because he'd write over and over and over and over and over. Then a capital L next to that over and over. Then he'd touch the E up a little bit. Then he'd touch the L up. And then he'd go to the M. He hated writing, but he could answer any question of anything we'd ever studied. He could spell out loud any word. He gave me 3 paragraphs one time on a boy and his dog. And I wrote it down. And 2 weeks later, I said, do you remember the story you did? He goes, the boy and the dog. I'm like, yeah. Can you kind of tell me what it was? And I'm holding it. He verbatim gave it back to me. Incredibly smart, but he couldn't write. Three quarters of the way through the school year, we did brain gym. Before we did brain gym, I had him write their spelling words 10 times each. He was mad. He was like just frowning as he pulled his book out. He's frowning as he pulled his paper out. In 10 minutes, he got his name, one word 10 times, one word once. So 10, 11, 12 words. Then I said, put him up. Now he's mad because he has to put him away. We did a 5-minute brain gym session. I said, without another word, everyone go back and continue where you left off. He sat down calmly, pulled out his work, started working. I timed him 5 minutes. He finished that one word 9 more times. He did 4 more words 10 times each. With that boy, that moment that happened, he said, I don't know what you did, but you fixed me.
Wow.
And the next day, some people challenge it like, well, what happened the next day? So the next day, first thing in school, they do board work. He hated doing his board work because it was writing. He sat down, did his board work, completed it. Same, the problem was solved. We continue to do brain gym as a class every day, at least once a day. The guy that I told you his name is Aaron, the one that
Hmm.
died. That's why I continue working with him because he would fall asleep within 10, 15 minutes of my sessions, and they wanted me to do sessions with this guy. I'm like, how do you do sessions with a guy who can't even stay awake? So I started working with him with the brain gym. Within 3 months, he was doing 2 2-hour sessions, staying awake and focused. He had been, at that point, about 12 years with his brain damage. His neurologist freaked out at the end of that year and asked Mom, what's different in his life? She goes, what do you mean? He goes, he's never been alert. He's never been awake. He's never been focused. He's never been engaging in conversation. And he's never been joking and laughing. And he's doing all those things now. What changed? And she explained to the therapist. He goes, well, what can a therapist do that would do all that? She said brain gym. He goes, well, what's brain gym? She described it. He goes, what you described makes sense. Continue
Hmm.
helping him do that. I worked with him for 4 years, and then that agency, due to COVID, I was no longer there. I left that agency. Now that I'm independently licensed, I'm working with him again. And the first time I saw him, he likes to learn languages. So I was working with him on Japanese, and I hadn't seen him in like 3 years. And the first thing he did when he saw me, he smiled and he said, Konnichiwa, Troy Sensei, which is hello, my teacher, Troy. And
Hmm.
he remembered me. He remembered that phrase. And it's like time had not passed. We were back working together. It's not really the neuroplasticity. That would help, like, because he's paralyzed on his left side. If I could
Mm.
do the neuroplasticity, he would have like movement, the paralysis would go. What I'm doing is I'm stimulating other parts of the brain that are normally not stimulated very well. and that helps with the
Okay.
memory, the focus. So his memory and focus gets better. He still has memory issues. He does. He still has memory issues. He's still very limited. He does like wordplay. He loves puns. We do jokes every week when I see him, and he laughs at the ones you think he would never get. He laughs hard at them, and he can tell you why. It's stimulating different parts of the brain and getting them to fire better. I've worked with people with dementia. You can't reverse a disease, but if it sparks more of the brain, then they're going to have a better focus, and it'll appear as if they're almost like you've reversed it. So I've worked with people with, that had strokes, and they were having some memory issues, where it showed significant improvement for a year or two, but eventually the disease will take them away, and they'll
Mm,
suffer with it.
that makes
But
sense.
you know what? If you give someone a quality of life for 2 years that they weren't going to have, I mean, this guy had no quality of life. 15 minutes, literally, he was asleep in
Mm,
his chair. He went from that to here we are 7, 8 years later now, better quality of life.
that's incredible.
Um, yeah. So I use that in therapy. I use it with kids who are struggling. I use it kids that have reversal issues, like if they're dyslexic, and I'm dyslexic. I was diagnosed at the age of 7, given good therapy. So I've incorporated two of my exercises for my dyslexic therapy because they're so much like brain gym. So I call it modified brain gym. And I've actually had kids that I work with at the clinic that their parents identify like they have this problem. And it's funny because this one boy, we identified his reversals of letters and numbers in his last session, and he was kind of down on himself. So I said, he struggles with language arts, but he's good with math. So I had him do a few math problems like 3 plus 5 and someone, and I noticed he wrote a 7 backwards and a 3 backwards. So I asked Mom, have they identified this? She goes, yeah, when he's in kindergarten, they've been working for him for a year and a half, but nothing's helping him. And so I said, well, let me do some things with him. And part of this, to show that it works, you do a pre and post test. You have them read out loud before and then read out loud after. You should hear a little bit of a difference to a large difference. So with this boy, I wrote 2 sentences down at his reading level. One is the boy saw the dog. The dog was a pug. The boy was a dog. And I stopped him. I said, okay, the boy saw the dog, saw. The mom goes, they've been working with him on this. He's not going to get it. And she's kind of being sarcastic over there. And I'm like, okay, let me work with him, please. I'm going to show you something that may be amazing, maybe not. She kind of rolled her eyes a little bit. So I had him do it 3 times. He kept saying the boy saw or was the dog, was instead of saw.
Hmm.
And the dog is a pug. And it was kind of choppy. The boy was the dog. Okay, the boy saw. He goes, okay. And then he did it so 3 times, and she's rolling her eyes big time now. Like I already told you, they've been working with him. So we did our 5 minute brain gym session, and when we were done, I had him read it, and he said, "The boy saw the dog. The dog was a pug, like that clear." And I looked at the
Wow.
mom. I go, "Did you hear that, Mom?" And she goes, her mouth was open. She goes, "I did." I said, "Write a 3." He wrote it correctly. I go, "Write a 7." He wrote it correctly. I go, "Did you see that, Mom?" She goes, I did." Now, this is the mom that's rolling her eyes sarcastically. Yeah, they've been working for me a year and a half, and instantly it fixed those two problems, those problems.
It's
And
fantastic.
so then I showed the boy the 3 and 7 he had done. He goes, "Oh, that's funny. Who did that? Those are backwards." And I go, "You did." And he looked worried. He goes, "Did I, Mom?" She goes, "Yeah, you did that. That was your writing." And he goes, "I wouldn't have done that. Those are backwards." And so
Wow.
as a therapist, though, I take a holistic view. It's if it's something I can do to help someone, I'm going to work with it. It's a psychological thing too to work with someone in this nature as well. Sometimes you see the Elmo stories where Elmo was one time done and healed. So I didn't know what was going to happen with this boy, and I told the mom he may need more brain gym if you can find someone who can do it. And I said, "We'll see." So I emailed the mom a week later, and I said, "How's things going?" And or another week later after that, she responded. So 2 weeks later, she responded. She said, "He is reading better. He's almost at grade level now. He's writing better. The teachers don't even understand why." And she goes, "There's no other explanation." She goes, "That brain gym really, that one time did it." So he's a one-time miracle. I've had a few of those, only about 3 or 4. And I'm holistic, so if I can see something where they need help with in that area, I'm going to help them. And it's therapeutic in the same sense. It's going to help him if he can overcome a problem. And I do a lot of brain gym sessions with kids that have trouble with focus because they're there for that reason. ADHD kids, I work with them on their focus. I work with other kids that have like some memory issues sometimes, like they struggle with remembering things. It's a tool I have. As a therapist, I can use any tool that I'm competent to use, including spiritual based therapy. I'm competent, so I can do it. I've had some people I offered them brain gym. They're like, nah, I don't think I want that. Okay, I'm not going to do that. But if they want it, yeah, I want to try something, and I'll go through it. And when you have a pre-test and post-test, and you see the significant difference in their reading ability, sometimes it's very minor, sometimes it's very, very prominent. And when you can see that, I work with a girl who has a speech impediment, and she has some other issues too. So we were working with her on brain gym, and it's funny because when she finishes brain gym and she reads out loud, she has troubles with the th sounds, this, that, the. So this girl, when she was done with the and she did her post read, she was still a little bit of a lisp, but it decreased that following that for a few minutes. And her mom and dad both got to see that, and I'm still working with her. I have another 2 weeks of service with her. But every time I work with her, we do that. And I tell the parents, I said, this potentially could help her with her speech impediment because she has been having speech therapy. And it helps her following for about 10 or 15 minutes. You can hear the difference. It's still there, but not as prominent. And so I told them, I said, I trained them how to do this so they can do this at home. And so they
Hmm.
do, they work with her, and, who knows? It may end up helping her ultimately down the road.
Everyone's talking about these modalities right now, but like EMDR, deep brain reorienting,
Mm-hmm.
CBT, DBT. What are your
Right.
thoughts as far
So,
as, deep trauma for that?
so cognitive behavioral therapy, CBT, works. It's the number one most prominent therapy in the world. And it is basically taking the negative thoughts we have, which lead to negative behaviors and negative feelings, and changing the negative to positive and creating a new path for your thinking. That's all it is. I'm creating a new path. Biblically speaking, if someone has a negative thought, I'm stupid, I ask the person this: is that from God or no? So I always start my CBT with a biblical perspective. First question is this from God? Yes or no? No. Okay, then we're not going to worry where it's from. The next thing is CBT says you want to stop the thinking, examine for truth, and then think of something positive. Stop the thinking, 2 Corinthians 10:5, that's where you were talking about. Take captive every thought and make it obedient to Christ Jesus. Stop that negative thought about you being stupid, give it to him, put it to him in prayer, and ask him, for the help. Then you're going to look for the truth because John 1 says that the truth will set you free.
Free.
And that's John 132. So we want to look for what's true. There's plenty of proof to show you're not stupid or whatever your negative thought is. And then Philippians 4:8 says, whatever is, it lists a whole lot of good things. And it ends with the key words, think upon these things.
Mm-hmm.
So scripture matches cognitive behavioral therapy very well. And
Beautiful.
I use the biblical verses to go with it as well for those that want it. DBT was created by a lady who has the borderline personality disorder, and she got a doctorate in psychology. And she decided she was going to create her own therapy because CBT wasn't good enough for her. So she created a therapy which works well. And they say about 95% of it is good, and 5% of it's just something she just threw in there because she's borderline personality. She could do it, and you can't tell her no. So, there's certain aspects of DBT that people are going, yeah, does that really, most people just kind of ignore it. But DBT does have some good effects. So here's where DBT comes in handy. If I have a negative thought and it's true, I can't use CBT and say it's not true and just wish it away.
Mm-hmm.
So DBT says I want to get dialectical, two different polars that can balance each other out. So I'll give you the example here. So I have a job that I hate a lot. really a lot. It's a brand new job. I hate it. I hate it. I hate it. I hate it. And then I get my first paycheck. It is really, really, really good. At that point, it balances out and I can tolerate the job because I like the paycheck. I find two different opposites and they balance each other out. That's dialectical behavioral therapy.
Hmm.
And it works good. It also talks about, focusing with the mind, using the mind to like look at things and just think, how do I feel? Do I feel hot? Do I feel cold? Do I feel happy? Do I feel sad? Non-judgmentally, just looking at your mind, doing mindfulness. A 15-minute mindfulness exercise, focus on breathing a little bit, focus on positive thinking, and then working on that to help overcome some of the negative thinking I have. So DBT does work, CBT does work, EMDR does work. But when someone has trauma, if I witness something really, really bad happening, a bus accident, I'm like, oh my goodness, that was horrible. 15,
Hmm.
20 minutes later, it went from the side that's living the moment to a side that just remembers the moment. If I have a traumatic experience and it doesn't shift from one side of the brain to the other side, then I keep getting stuck reliving it,
Wow.
and that's trauma. EMDR does certain things that has you relive by talking about it. You relive the moment, and they do certain movements with the eyes. They do other things with some tapping, and that helps
Hmm.
transfer it from one side of the brain to the other. So
To
EMDR is
process
is
it.
proven. Yeah, yeah, yeah. It does. It helps
Okay.
you move it from where it's still living to where now it's just a memory.
Interesting.
Yeah. So EMDR does work. There are some other modes that work well, and there's some other ones that I'm real skeptical of. If I
Yeah.
know it works well, I use it. I'm eclectic in my work. I'm always looking for new things. That's the advantage. ADHD is not a disability, it's a different ability. If you can learn how to overcome some of the problems with it, it becomes a super ability.
Yeah. I agree.
And as an ADHD, I think in my own box. All my peers, they do what they know works, what they've been told works. They go for the easiest route of therapy. I look at those things and I consider them, but I also look for new things. I'm always looking for new things and I apply new things. I use Brain Gym. Right now, I'm putting together a lot of work for the ADHD kids and adults, basic therapy using the concept of executive functions.
That
So
is so important.
executive functions are important. Working memory is an executive function. Creating exercises that will help someone gain those executive functions that normalized people get when they're 4, 5, 6, 7 years old. And so if I can do that with those tools, so I'm putting together that's thinking outside the box.
I really think you could be servicing a whole big community here in Arizona.
Yeah.
Are you accepting new clients? I was going to ask you, is how do people find
Okay.
you and connect with you? And do you
Yeah.
work with clients outside of Arizona or not?
I'm only licensed in Arizona. If one of my clients goes to California on vacation and they want to do telehealth, I cannot do it.
I have a tough question for you. Do you have any thoughts about physical versus spiritual, demonic, generational curses as causes for mental health struggles?
Okay, that's a good question, and I do because as a spiritual based therapist, I have to have some perspectives.
Right.
If someone comes to me and says they think that it's a demonic issue, I'm on a fine line because I do work with a licensure also for mental health, but because I'm doing a spiritual based mental health, I will say, okay, if that's what you think, I'm not there to do an exorcism, so that's out of the question. I will say we can look at it as potentially that, but also, how about this? We also work with some therapy. Here's the biggest thing I can tell you. I had a lady who heard voices, and she said it was demonic. There's definitely mental issues that will cause this, and medication can help. So here's my perspective. If medication helps, it's not demonic. Demonic would be beyond that. If the medication doesn't help, then perhaps it is. Now, if the therapy helps, it's not demonic. I worked with a boy who's 17. I was the first person he'd ever told in his life that he heard voices and saw things. And he said to me, I don't know if it's demonic or whatever. He goes, I kind of always thought it was or whatever. And I did therapy with him. He didn't want the medication, and the therapy helped him about 90, probably 98% of the time. The voices were diminished, and what he was seeing was gone. So the therapy helped him. Certain aspects of therapy helped him like pretty quickly. So for hearing voices, there's something called subvocalization. Subvocalization is the sound of the voice you hear when you read to yourself. And I believe
Mhm.
this. I think man has enough sinfulness in our own mind and heart that we're going to create our own problems. The
We don't
demons
need
aren't.
extra help.
We don't need extra help. Mental health wise, again, if it can be explained, if it can be removed with medicine or with therapy, subvocalization, when they read 2 or 3 minutes to themselves and focus on the voice they hear in their mind when they're reading, and the voices diminish, that tells me that that's not going to make a demon flee. I've had one person who it could have been. I
Mhm.
I'm still skeptic, but there was a lot of things about their issue that made me think, yeah, it could very be spiritual. Now, here's the side: if they tell me they're a Christian and they're possessed, my perspective is you cannot be a Christian and be possessed,
Right.
because greater is He who lives in me than he who is in the world.
Mhm.
And if Jesus is in my heart, my mind, my life, no one's going to take me out of His hand. No one in heaven, on earth, or below the earth. Right? If I'm in His hand, I'm His. There's no room for demon possession in me. Now, can a demon bother me? Sure. But I think for you to hear voices, that would be within you. And I've worked with a lot of people who have these issues. And therapy or medication or a combination thereof can help and work. Very rarely does someone have a good success, though, with them with just therapy without the medications. It's a chemical imbalance. Just like ADHD is a chemical imbalance. My dopamine level is lower than your
Mhm.
dopamine level. Because of that, if you are not ADHD, if you drink your coffee, you get really high dopamine and you get scattery and whatever. Dopamine in a ADHD person is a little bit low. A stimulant raises it to normalized. A person who's normalized has a caffeine or something like that, a stimulant, it raises it above normal, and they're jittery, jittery, jittery. They can't sleep. They're jittery, jittery until it wears off and comes down. The reason I do caffeine is my mom didn't want us on Ritalin. Ritalin was the medication of the day, and she didn't want us on Ritalin. And so the doctor says, well, either you do nothing, which isn't working for you, or you give them straight black coffee before school every day. My mom thought that was great because at home I was really focused and calm and not bouncing all over the walls. She'd send us to school that way. About 25, 30 minutes into the school day, it wears off because it doesn't last that long.
To wrap up, could you repeat what your website is, and I'll put it on
Yeah.
the screen as well?
My website is D as in dignity, DVW, Dignity Value Worth, therapy.org. Go to Alma, ALMA. Alma is a company that credentials therapists, and they do the billing for us. You'd have to request me through a consult. I am limited in what I'm doing right now with it. I do work in a crisis care therapy here in the Valley. It is called Mind 24-7, Mind 24/7. The one I work at is at the Metro location over by the old Metro Mall of I-17. It is a crisis care clinic. You can walk in without crisis care. We can do 12 weeks of therapy. And so if someone
Okay.
wants that, they can walk in and request me at Mind 24/7. That's covered no matter what your insurance is. My private practice, I do Mondays primarily, and I do some on Saturday. My Saturdays right now is taken, it's filled. I have some opportunities for Mondays. I either do telehealth, or if they live in an area where I can transport to, I will meet them where they're at. And they can choose a place. Some feel uncomfortable with you coming to their home. Others love it because they're either disabled and can't get out easy enough. They don't have transportation. People, if they're comfortable with me going to their home, I'm fine with that, as long as their home is safe. If someone doesn't have insurance and they want to pay cash rates, and they can't afford that, I do a sliding scale as well. We do
I'm
what we
so
do.
thankful you didn't step in front of that bus.
Me too. Me
God
too.
really.
Yeah,
God really lit up your path and you're helping so many people. And
yeah,
I think your story is so important for people to hear because a lot of people are
yeah,
finding their identity in what other people think of them or what social media says. And there's a lot of pain, especially in our young population. So I just want to thank you so much for spending your valuable
yeah.
Saturday with me,
Thanks.
sharing your story.
God told Satan, you can do anything you want to Job, but you can't touch his life. God puts parameters on what he will let Satan do. It's suicidal attempt. That I do think that is, almost in the demonic realm of mentality. I mean, there is a devil who pushed and pushed to try to get rid of me. God used that bad moment to show his power and his grace and his mercy and to change a life.
That's what God does. He turns
That's exactly
darkness
what
into
God does.
light,
Yeah.
ashes into
Yeah.
beauty, and He did that with your life.